There's some folks who've been active on this issue who have personal stories that we're going to hear first, who live right here in Harford County. And so I'm going to invite Russ Kovach to come up, who is a dynamo locally, as everybody knows, head of the Young Dems here locally. And, you know, it's incredible when you get into this issue that you hear that people have these stories of what has happened to them, and I didn't know, because I'd worked with Russ. You know, we did that thing up in Bel Air a few months ago, and I heard just last week he told me the story of what happened to him. So come on up, Russ, and tell us about what your own family had to go through.
How does this work? On that side there?
All right, well, first off, I can't take all this credit. I need to thank a lot of people for getting the word out. Art Helton did a great job getting the message out. The New Hartford Democratic Club went down with the campaign. All of the Young Dems had a big part in this. We went through all sorts of groups, NAACP, tons, trying to get the message out to everybody. I also want to take a second to acknowledge two people. We've got two true bona fide healthcare heroes in our state, one of which is one of 18 senators to sign a letter to Senator Reid. Senator Mikulski is one of those 18, saying let's try to get the public option through the Senate via the budget reconciliation process. So let's hear it for Senator Mikulski. And Senator Cardin is a group of at least another 10 or so senators who have said that they will support the process. So let's hear it for Senator Cardin. All right. We are very lucky to have those two representing us down in the Senate, not only to help Marylanders, but to help Americans at all. I wanted to talk for a second about a story I know, actually a couple of stories. I'm lucky, I'm one of the ones that has pretty decent health care. So clearly I'm not going to talk about myself, but I am going to talk about my parents. My mother and father owned a hardware store in Perry Hall. It was a small business, of course, 10 employees if I remember right. And like all small businesses, they had quite a challenge getting health care and settled on an HMO. Something, frankly, that I pretty much directly blame for my father's death in 1996. But it's not my father I want to talk about today, it's my mother. Following the death of my dad, my mom, as you might imagine, lost her HMO coverage, lost her health insurance, and it didn't help matters much that prior to that she had developed diabetes. Diabetes, huge problem in this country, as I'm sure you well know, and of course it makes it so that no health insurance company was going to pick her up. So what's that mean? My mother did a really good job using my father's life insurance money to balance things like paying for the mortgage, buying food, buying her medicines, and seeing doctors when she needed it. This was fine and dandy until 2002 or so, when she had a bout with congestive heart failure. The result of that was a visit to the hospital that my mom did pay for out of pocket, but those costs made it very, very tough to do other things like afford medication. She didn't want to be a burden on my brother and me, and as a result, she stopped paying for that medication, which is quite an issue when you've got diabetes. It was a cat scratch. A simple little cat scratch that really made things worse. As I'm sure any of you know who happens to be a diabetic, there's no such thing as a minor scratch when you've got diabetes. The scratch got infected. 3 weeks in Upper Chesapeake Medical Center over Christmas of 2003 left my mother with a $16,000 bill. The subsequent trip to shock trauma and the amputation that followed left her with an additional $325,000 worth of medical bills. The recovery time at University Specialty Hospital cost $25,000 a month. Only then, after accumulating more than $500,000 in medical bills, losing her house, losing essentially every possession she had acquired in her entire life, was my mom finally able to get onto Medicaid and made it to a nursing home where she lived for the next 4 years at a cost to the federal government of at least $5,000 a month. Fortunately, my mother now, she's 62, so she's been able to get Social Security benefits and was able to move into assisted living down in the city. But you have to ask yourself a serious question. Wouldn't it have cost the federal government a whole heck of a lot less money to simply have a public health insurance plan that would have stopped travesties like this from happening to begin with? The saddest thing about all of this to me was I can't think of a single time when I went into that nursing home when I didn't see other people in the same exact situation. Her story is not unique. There are far, far too many people who can tell almost the same exact story, which means this health insurance reform process that we're fighting for is not just about one person. It's not about my mother. It's not even just about the marchers that we're going to hear from today and the people here. We're talking about tens of thousands of people across this country who are either uninsured or underinsured who really, really, really need this reform process to occur. What can we do? To me, right now, it seems like we need to send a message not just to the conservatives that are opposing this, but to the Democrats in Congress.
Amen.
Yes. Send the message to them to do the right thing.
Yes.
Send the message to them to do what we elected them to do. Send the message to the Democrats in Congress to stand up, be tough, be strong, and pass health insurance reform now.
Yes.
Thank you, Mark.
Thank you, Russ. You know,